Hello, my name is Dr. Tiffany Zigras, and I'm excited to share some important news with you about the launching of primary HPV testing, which is starting on March 3rd, 2025. With this essential change, it's a commitment towards cervical cancer prevention in our region. Human papillomavirus, also known as HPV, affects millions of people. Almost 80% of us will have an HPV infection in our lifetime. In most cases, the HPV infection will go away on its own. But for some people, the infection will persist, and it is those few people who will need treatment. You might be wondering, why is this switch happening? Well, cervical cancer screening is done to pick up early changes in the cervix, long before cervical cancer even develops. HPV is responsible for 99% of cervical cancer cases. The HPV test is more accurate than our usual pap smear test and will improve detection of precancers on the cervix. The improved performance of the HPV test allows for longer intervals between screens for people who test negative. It detects high-risk strains of HPV that are most likely to cause cervical cancer. Certain strains of high-risk HPV, like HPV 16 and 18, are responsible for 70% of cervical cancer cases. HPV testing has a high negative predictive value as well, which means that it's more likely that a negative result will correctly identify people who do not have a cervical precancer or cancer and who are very unlikely to develop a cancer in the next 5 years. So you might be wondering, who is eligible for screening? When can they stop screening? And how often do we need to be screening people? Well, while we launch primary HPV testing in March, the starting age will be 25 years old for all people in Ontario. People can stop regular screening at 70 years old as long as they've had a negative HPV test between 65 and 69 years old. With primary HPV screening, those who've had a negative HPV test will need to have a repeat test in 5 years. As we move to the new screening, you might be wondering when to screen your patient who's had a negative pap test. If your patient's last pap test was a routine pap that was negative, then you'll repeat that at the usual time interval. If the HPV test is negative, then their next screening test will be in 5 years. We will cover what to do with a high-risk HPV positive test in a future video. Stay tuned for more updates on the change to primary HPV testing as we approach March 2025. If you have any questions, please feel free to reach out to me. And for more resources, please look in the description box below, where we have some very helpful resources for Ontario Health. We're very excited to embark on this journey with you.